Hello, my name's Jeffrey. I think I saw some of you guys last year. It's nice to see you again. Um, Religion 6A. You guys had a lot of very good questions. So I didn't answer them in exactly the same order they were asked. I kind of grouped them so they would make more sense and they would flow a little bit better. So I'm going to start off with a couple of questions from Irene, Alexis, Avery, and Daniel. So Irene asked, how long have you worked at a hospital? I worked in a hospital for about 3 years. Alexis asked, what did you do for your semester at hospice? So the semester I took a hospice end-of-life care course. I helped take care of two patients who were in hospice over a duration of 4 to 5 months. So I would see them about every week or two and see how they were doing and see if they're pain, if they're nausea, if they had any symptoms that they wanted better control of. Avery asked, what college did you go to learn this skill? So I went to college in Emory, where you guys are from, in Atlanta, but I actually learned these hospice skills at LSU Medical School in New Orleans. Daniel asked, how many hospices have you worked at? So I've worked at one hospice, the hospice I worked at to do the course. But when you work in a hospital in general, you frequently come into contact with a lot of patients who are in hospice. So Bolin asked, why did you take the end-of-life care course? I think that's a very good question. It's also something I'm glad you guys are learning about at your age, because oftentimes people don't understand what hospice is. They think it's like what they call death care or something. So the reason I want to take it is because I think it's important as a future doctor that I understand that sometimes medical care should always focus on medical care should always be focused on the patient. Sometimes physicians get so focused on treating the disease that they forget that the most important thing, the reason why we are in this profession, is to take care of patients and to do what is best in the patient's best interest, not what we feel is correct, not what doctors feel should happen, but what patients truly want. So, for example, there's a disease called cystic fibrosis, and that disease causes your lungs to be destroyed at a young age, usually around your 20s or 30s. And we actually do have a lot of drugs and a lot of medicines that can treat your symptoms, but we still cannot cure it. And so, at the end of these patients' lives, oftentimes instead of wanting more medicines and more surgeries and more antibiotics to try to help them, oftentimes they want to stay home, see their family, and die peacefully at home instead of staying in the hospital, getting treatment after treatment, and still getting worse, and dying in the hospital. And so that's one of the reasons I wanted to take this end-of-life care course, is to understand how do you transition from conventional treating of the disease to learn how to continue treating the patient but not be so focused on treating their disease, but treat them and what they want. If that doesn't make sense, tell Miss Harper and I can explain a little bit more. And so Kayla asked, do you like to work at hospices? It's not so much that I like to work at hospice as I find it's a necessary skill. In today's world, we're going to see people are getting older and older, and it's going to be very important to understand end-of-life care situations. Grace asked, does it take a while to feel comfortable? Of course. Of course. Just like with anything else in life, it takes a while to get comfortable to talk about death, saying the words die, you're going to die. Those things take a while to get used to, but it's important to use the word die and death and not try to code it by saying passing away or, you'll no longer be here or something like that, because when you try to sugarcoat things, patients often don't understand, and when you say die or death, that helps them realize that that is what's going to happen in the future. And so does it take a while to feel comfortable? Yes. And there are a couple of things that I feel that can help. Is the first thing to do to get to feel comfortable with hospice is you have to understand what hospice is. What is the purpose of hospice? Second thing is listen to your patients. You have to understand what they're saying. And the last thing is, yeah, kind of lost my train of thought. Anyways, next question. How do patients react to hospice? That's a very good question as well. It varies. So some patients, very few, are like totally, weirdly enough, okay with it and realize they're going to die and they actually want hospice treatment. I would say most patients are reluctant at first, and at first they're in denial, but eventually they come to realize that hospice is very beneficial for their care. And finally, there are always a couple of patients who absolutely do not want to have anything to do with hospice because they think it's like some sort of death sentence, and that they want to keep trying. They feel like hospice is giving up, and they just refuse to believe that they will be beaten by their disease. They want to keep trying to beat their disease, which, I'm not saying to give up. That's not what I'm saying. But it's important to realize when your quality of life is so diminished that hospice will help. Let's see. Ali asked, what kind of patients do you usually see in hospice? So it's actually very diverse. You can see a lot of genetic diseases. Cancer is a big one. You see also, HIV infections. You can see a lung infection called a lung disease called COPD. It's a very diverse group of patients. And then Luke asked, do you usually see contagious diseases in hospice? Not typically. Most contagious diseases are treatable by antibiotics and certain antimicrobial drugs, but it's an interesting question because sometimes when patients are in hospice, their body does get very weak, and when your body gets weak, you can't fight infections, and you end up seeing a lot of pneumonia. You see a lot of blood infections, skin infections, bladder infections, a whole bunch of things. And so even though the reason they're in hospice is not because of infection, you often do see infection associated with hospice patients. So Grace, no, actually, wait, what? Someone asked, how long do patients usually stay in hospice? So in order to be enrolled in a hospice program, you actually have to have a physician sign off saying that your life expectancy is less than 6 months. Physicians are often wrong, and they usually are. So sometimes when they say that, patients can live longer than 6 months, or sometimes they can live 1 or 2 months. It just depends. But it is the physician's role to say, I, with my medical training, believe that this patient has a life expectancy of 6 months. That is one of the prerequisites. So it's really hard to say how long people stay in hospice. My patient actually stayed in hospice for 1.5 years, and when I finished the course, she was still alive and not necessarily kicking, but doing pretty well. Abril asked, do patients sometimes go all out of hospice? And yes, occasionally. Medicine is not a science, it's more of an art. And sometimes the art of medicine, you don't know what's around the corner, and so sometimes patients do occasionally go out of hospice and back into regular care. But it doesn't happen often, but it does happen. Taylor asked, what types of question do you ask the patients? So, very good question. So, you have a patient in front of you, and your medical knowledge tells you that they will die in about 6 months. So how do you start the dialogue? The first thing to keep in mind is always focus on the patient. Figure out what they need. What are they afraid of? What symptoms do they have? The 3 most common symptoms patients have in hospice are: number 1, pain; number 2, constipation; and number 3, nausea. Nausea is the feeling like you can't eat and you want to vomit. And you can imagine if you had pain and you were constipated and you had a lot of nausea, you would be extremely uncomfortable even if you did not have a terminal illness. So, but luckily we have a lot of good medications that can treat pain, constipation, and nausea. And that's why it's important to assess and figure out how much of those symptoms they're having so we can treat it. So number one is focus on the patient and figure out what